Beating hearts don't lie. An empty page, a story to write. I'm in love, you're divine, and it's all in our signs. We're going away. Get your bag, check the tag. Decision is made. Lock your door, need no more. It's already paid. Cancel your mail for a while. It's a journey for life, and I'm your ride. Hang on, we'll be long gone. Hang on, I cannot go wrong. God, I'm praying I'm not alone in this air of hope. 'Cause I'm in love, you're a star, burning bright in my heart. We're going away. Get your bag, check the tag. Decision is made. Lock your door, need no more. It's already paid. Cancel your mail for a while. It's a journey for life, and I'm your ride. Hang on, we'll be long gone. Hang on, I cannot go wrong. We're going away. Get your back, check the tag. Journey for life, and it's already paid. Cancel your mail for a while. It's a journey for life, and I'm your ride. Hang on, we'll be long gone. Hang on, I cannot go wrong. Hang on, we'll be long gone. Hang on, I cannot go wrong. God, I'm praying I'm not alone in this air of hope. A journey for life, I'm right. No, no, no.
Good evening, everybody. I'm Nate Manahan from Indianapolis, Indiana, where it is not storming, it is not lightning, it is not thundering, it is cold and gonna snow. But hey, we got electricity, and we are gonna do an Ask a Doctor MG Wellness here. And let me bring up the good doctors, Dr. Kelly and Dr. John. How are you this evening?
Doing
Freezing,
great.
but wonderful.
All right, so as we get started, let me do a couple housekeeping steps, and then we'll get right into some of our questions. At any point tonight, you can share this right now. Those who are watching, we would love it if you click on the button share it with your friends and family, get them in early in the live so they can ask questions in the next hour, and they join us here at Ask a Doctor Live. We would love if you ask questions. So already we see several people saying hello. Tanya from Tennessee, Diane, Ruth, Michelle, thank you so much for greeting us. We're so glad to be here. We're glad that you are able to be and join us. If you have questions, comments, really anything goes. Some of them we may not answer, but I would love it if you would absolutely ask those questions. And lastly, we hope you enjoy this evening. In a time where life is a little crazy, the coronavirus quarantine is going into our 165th day. We are now going to come to Dr. John and Dr. Kelly because they're going to give us a update on where we are with coronavirus, COVID-19.
What do you want to talk about first?
You can talk first, and I'll fill in.
So where should we start? What is encouraging,
Always a good place.
Good place to start, is that there continues to be evidence that we are not only flattening the curve, but that we are getting on the other tippy-top side, coming down that curve on new cases. Even though we are testing more, we are having a decline in new cases. That's not occurring every place in the United States. There are hot spots, but we are seeing a consistent overall decline throughout the nation.
And one of the things when you're talking about hot spots and not seeing a decline is that you can't look at the United States as a whole. We're way too big of a country. You have to look at every locale as an individual infection pocket. And each one has their own cycle with the virus, with the infections, and with death.
You want to talk about the cycle that you were just reading about?
So what Dr. Kelly's referring to is that if y'all remember a few weeks ago when all these incredibly scary details came out of especially Britain and their models for the virus, when they were talking originally about millions of deaths and then down to hundreds of thousands, now then down to 60 to 70,000 and now down further, that this was all based off of theoretical data. And as I said before, crap in, crap out. If you don't have the right data to put in, which we didn't really have any data, they were basing it off historical models, which was the appropriate thing to do. But now we actually have data from multiple locales outside of China where we don't have real data from. But everything from South Korea to Sweden to South Africa to Israel to Spain to Italy and to parts of the United States, what's interesting is they're showing the exact same infection curve for all of the locales. Not the same outcomes.
Not the same death rate curves, but the same rise and fall over a certain period of time, which a study out of Israel says about 8 weeks is that rise and fall of new cases, that it seems that multiple locales are following that same pattern.
Yeah, and that what's interesting about that is whether or not they were put on lockdown.
Yes.
Where in England they were put on lockdown so bad that police arrested people, to Sweden where all they did was anybody over a certain age was put on social distancing and everything else kept functioning. So if that pans out, then hopefully we're getting towards the end in most locales, though there are a few that are sort of picking up late.
Yes. So all of that to say, it looks like in multiple locations, we're getting on the other side of that peak from new diagnosed cases. So that is a bit of encouragement. Let's talk about where treatments lie and what's going on with remdesivir, hydroxychloroquine, and azithromycin. Yeah.
And I'm going to bring up one of my closest friends first, who was asking if tonic water was prophylactic. And he's asking that because
tonic water is called quinine.
And all of these drugs, not remdesivir, but hydrochloroquine and chloroquine, are quinine derivatives. Quinine was originally used as an anti-malarial back, especially in India, which is why you have the British with their Bombay Sapphire and Tanqueray gin and tonics at 3 p.m. because they were trying to prevent malaria. So
there you go. Little history lesson for you.
And I'll let you make your own decision on that, whether or not you want to use that as your prophylactic. There is no data to support that. However,
don't use that as a treatment. Anyway, hydroxychloroquine and azithromycin
have been shown to be very effective.
So let's talk about the study.
A new 1,061 patient study came out of France from the same person who did the original study. And no, it's not a randomized trial. We're not going to even get into that. But this is an infectious disease expert, someone who is world renowned and world respected, that he had in critically ill patients hospitalized, starting to go downhill, not yet ICU and intubated, but
very sick.
But very sick, that basically out of 1,061 patients, only 170 progressed at all onto a ventilator. The rest were all cured. And out of those 170 that progressed onto the ventilator, 130 were still cured.
Only 40 passed away.
With 40 passing away at about a 4% death rate, which is amazing if you think a 4% death rate, not out of the whole country, but out of the critically ill. This is in comparison to Italy, where they have a higher death rate out of all the people that were tested, not out of the critically ill. If you talk about the critically ill, their death rate was astronomical. So the drugs work. I mean, no, it's not a randomized trial, but in large observational studies, they work.
1,000 patients, that's a good amount to be testing of those who are critically ill. And a randomized trial, to be quite honest,
is unethical.
Would be very unethical. What that means is you have two avenues in the study. You're critically ill and you don't get the medication. You're critically ill and you do get the medication. And there are real ethical issues with that when someone is that sick. So this is a very encouraging
And anyone
study.
that argues about that methodology isn't the one sitting there critically ill waiting for a medication.
Right.
You
so
know,
that's very encouraging results.
Very encouraging.
Let's talk about,
I was going to say, and you will see people confuse hydrochloroquine and chloroquine constantly in the media. They're not the same drug. They're different drugs. Just because they both have chloroquine in it doesn't mean they're the same thing. The U.S. Army has started to use, the U.S. military has started to use remdesivir. Remdesivir has been used in multiple diseases. And remdesivir has been shown to work very effectively in ill patients also.
Yeah, we don't have any large studies like the one out of France, but those will come with time, and the initial results look to be encouraging.
And part of the reason they're not going to come as quickly is you're talking about hydrochloroquine, which is a 50, 60-year-old medicine that is dirt cheap, versus remdesivir, which is a pretty, a relatively new medication that's expensive.
Right.
And so if you have a cheap drug
That works.
why are we even looking at the expensive drugs?
Right. And then the last piece that we were going to talk about is where the vaccine trials stand. For some of the companies that have vaccine trials underway, the phase 1, where you determine is it safe in a group of patients, the phase 1 trials have been completed, and we're on to phase 2 trials,
And
where we look at it if it works.
for those of you that are wondering, in a phase 1 study, in general, you're looking for acute or reactions right away. They will follow those patients for another year to see if there's long-term side effects. But obviously, you don't wait till the end of that year before you start a phase 2.
Especially in an emergency situation like we find ourselves. So that is encouraging that we are on to phase 2, where we're going to start looking at efficacy and whether or not these vaccines can be helpful. So we're not going to make any predictions about when vaccines might be available, but we are certainly hoping and praying that they are available when a future spike next season may occur.
So one of the things that people ask is, why do these diseases come back a year later? And to understand why they come back, you have to think on a global perspective as opposed to thinking on a hemispheric perspective. Meaning you can't look at the northern hemisphere and go, oh, wait, we're all getting diseases in the northern hemisphere right now. You have to look at the whole world. While we're in spring, remember the southern half of the world is going into fall.
And so their
Just starting their cycle.
potential spikes are going to happen over the next several months when they are in the fall and winter months. And so then
That's how it cycles.
it comes back around to the north as we enter fall and winter.
And so you will see that. And
yeah, so that's a normal pattern that is followed. So that's an update. Clear as mud. Excellent.
And I think one of the things people are asking regularly is where would we be now? And this is nearly an impossible question. If we hadn't self-quarantined, has the thing we're doing right now working? And in your opinion, is what we've experienced the last 4 weeks, is it doing what it's supposed to be doing?
Yes.
okay, so you have to look at it from what could have happened.
Yes.
And if this hadn't been done and something bad had happened, everyone would be screaming at everybody. And
We know that this virus is incredibly contagious. We
Right.
know that.
however, at the same time, you have to look what Sweden did compared to what we did.
And I think when I look at that, and when we look at the overall data from the United States and from other countries, we know that the greatest risk is in those who are older. And no, we are not there yet, although we are inching closer every day. And those who those who have comorbidities. Comorbidities, other illnesses is what we mean by that.
And other illnesses, what are we talking about? Diabetes, heart disease, obesity.
Cancer,
And
lung disease.
Sweden is actually a relatively healthy
Right.
population.
So you're already starting with a healthier population.
Exactly.
And then they are quarantining or distancing those who are at risk by age.
Yes.
So it's a very, very different population.
And it's not a population that has a tendency to move around a country as much
as we do.
on a daily basis.
Right. Flying here and there,
And so it's
driving here and there.
It's a different situation.
Right. Completely different. And one of the things that this has really emphasized to me is that we have talked, good grief, how many times on Ask a Doctor, we've talked about how the U.S. is such a sick nation. We have so much illness. And if you want to see an example of how other illnesses are affecting us in this particular virus pandemic, it is profound. And it behooves all of us to, for lots of reasons, get healthy.
The people under 50, under 40 that have passed away from the illness, when you look at all the data, very, 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 very few of them didn't have multiple other illnesses, whether it's high blood pressure, high...
Obesity is the largest risk,
largest.
and I didn't say largest for that cute little punny.
That was actually good.
I know.
I didn't even say that.
Obesity is the major risk factor in the United States, and that has been proven over and over and over in multiple studies.
And that was what Europe was warning us about, literally, before it hit the United States, that at the beginning of March, when all of this started to really come out, when the World Health Organization finally admitted that it was transmissible to humans, that Europe started to say, you know, with your
population,
with your rate of
obesity, your population's going to be at serious risk. And so back to Nate's question.
I was going to say, so if you look at what other major country is as obese as the United States? Germany. They're the number 2 large country. You can't count American Samoa because there's 12 people there. Just kidding. I know it's larger. But Germany had to do the same thing we did, and they've done a good job flattening the curve and keeping their death rate,
right,
very low, in the low percentages. Had they not done that,
it could have been bad.
But
so
Sweden's a healthier country.
I do believe that what we have gone through, even though it is
necessary,
it is painful and
it's horrible.
It is causing
it's destroyed the economy,
massive emotional stress, and I think that's the other aspect of it that we need to
talk about.
Well, we're going to talk about it next week, but
good idea.
Yeah, I'm pretty bright about that. But
wow,
that
piece,
that emotional piece, we can't forget. So we're going to talk about that next week. But I do think that what we have done over these past weeks has likely protected many, many, many people.
Yes.
So let's look at a couple other things when it comes to the coronavirus. Last week we were talking about exercise and how that can help us to fight disease. Before we get into our topic for tonight about medications, what can we say about exercise, just kind of recapping, because we didn't get to do a whole episode last week, and what that impact would be on obesity and on fighting disease like coronavirus?
So we know that 30 minutes of continuous, see, I said it correctly,
yes,
exercise, aerobic exercise, 5 times a week decreases your rate of heart disease, diabetes, cancer. If you have cancer, it decreases recurrence rates of cancer, and it decreases obesity, and it helps your immune system. Ta-da! There's a couple studies that say 3 times a week, but those have been in where the studies have been done, they've been replaced by 5 times a week.
Yes. So this is the thing, 30 minutes. I mean, good grief, right now, I know you have 30 minutes. I know you do. We all do. We have more than 30 minutes, but just take 30 minutes for the love. Please do it.
Isn't that that's a very interesting point you bring up, actually, about how we have more time now, but because we're not commuting, we're not traveling to work, we have more time now, but so many people are actually gaining weight.
Baking, making cookies, making pies.
Instead of doing that, go walk.
Just go walk.
Do it. Put a time lock on your refrigerator that only opens up a couple times a day.
Exactly. Just walk.
Or as one of our nurses, did you see the picture she had?
No.
She had a picture of her refrigerator with a bikini hanging on it.
Yeah, that's going around. Mm-hmm. Yeah, I didn't post it, but I thought it was funny. Just get up off the couch, and I don't even care if it's cold. Okay,
you can still.
I don't care. You have a coat, put it on.
You wear it when you're going to work.
That's right. Just go walk, and when it's sunny, you're going to get your vitamin D, and you're going to get movement. It's going to help your mind. It's going to help your health. It's going to help you fight infection.
Yeah. Exercise has actually been shown to help mental health.
And as minimal as 30 minutes a day, 5 times a week. That's it. So just do it. Just do it.
Wow. That would be a great slogan for a company.
Yeah. It's hilarious.
You guys are so original. It's amazing.
I know.
You guys got it all figured out.
Brilliant.
Patent it.
Let's talk about medications now. And so let's start with the ones that are prescribed that you get from behind the pharmacy counter. What are those medications? We've talked about antibiotics lots of times on Ask a Doctor about how they impact the gut. They can hurt immunity, breaking down the probiotics that are actually doing good thing or about good bacteria in our stuff. Thus, we need to be taking probiotics. But what are the other things that are, when it comes to medications, that are affecting our immune system or our ability to attack and stay healthy?
So first question, how many of you out there are not actually taking any medications over the counter or prescribed? 0. I'm not hearing a lot. Oh, wait, we have one doctor here.
Yay. I didn't used to be that way, but I am now.
No, since she's gotten healthy over the past year, she went right off of.
Yeah, off all my medications, but it's pretty rare. And if you, shout out to you, if you're putting.
Well, you're only 33,
me.
so.
Well, yeah, I am. Whatever. So let's start with some medications that are kind of, known for affecting infection rate. Like you'll see advertisements, which I'm not going to go into how frustrating advertisements on TV are about medications, but.
By the way, you want to know why your medications cost so much? From when I got my health economics degree, the largest part of all of the major pharma companies' budget was advertising.
So when you see that and they list things like, if you die from this medication, call your doctor, which many of them say ridiculous things like that. There are a lot of medications that are widely known to affect the immune system. Anything that is fighting rheumatoid arthritis, anything that is fighting psoriasis, anything that is steroid, anything that is purposefully shutting down your immune system.
Or ramping it up.
Correct. So those medications are known, Remicade, Humira, all of those medications, and steroid pills, dexamethasone, prednisone, solumedrol, yeah, all those.
Cortisone.
And any of the creams that are steroids, those are known to decrease your body's ability to fight infection.
Obviously, chemotherapies.
Yes.
But chemotherapies aren't just, now they're no longer just used for chemotherapy. I mean, for cancers, chemotherapies are used for things like bad rheumatoid.
Methotrexate.
Methotrexate, Cytoxin, cyclophosphamide.
Right.
These Fudex, 5-FU, 5-fluorouracil, I'm not supposed to say 5FU because it makes me sound like I'm saying something bad, which I'm not. But it's funny.
I swear.
Anyway,
Boy humor.
all of these medications, like Dr. Kelly was saying, affect your immune system and put you at risk for infections.
So let's talk about some medications that have been shown to adversely affect your ability to fight infection that you might be surprised by.
But are we still going to talk about the ones from behind the counter first?
We're still talking about the ones behind the counter.
Okay. Sorry.
Doctor.
I got that look.
So,
You know that look.
statins. So it has been shown that statins, that are a group of drugs that decrease cholesterol levels in your bloodstream, those medications have been shown to decrease the effectiveness of the immune system.
Yep. They actually are so effective at decreasing the immune system that when they are used when people who have had transplant surgery are on them, it actually decreases their chances of rejecting the transplant.
So while it's potentially advantageous in transplant patients, it's interesting to note that statins decrease the body's ability to fight infection.
So what's a better way to lower your cholesterol?
Get healthy.
Yep.
Telling you.
Stop eating anything with high fructose corn syrup.
And I know that doesn't make sense, but if you read our previous episodes,
it's absolutely true.
High fructose corn syrup leads to high cholesterol.
It's not the fats you're eating that lead to fat in your blood or cholesterol in your blood. It's the high fructose corn syrup.
All those processed foods in the middle of the store, in the boxes, bags, and cans. Okay.
Beige foods.
Beige foods. Oh my goodness. Okay. Listen to this. Going to tell you just an observation I made the other night.
Was I part of this observation?
No. Okay. Well, I told you about it. Saw an ad on TV for a restaurant that will remain nameless that was offering a special.
Was it something like this?
No.
Oh.
That was all beige. Biscuits, chicken fingers breaded and fried, and French fries.
And didn't they all dip them in the same thing?
Mashed potatoes with beige gravy. Don't eat that, please. Don't eat it.
As we've talked about before, you want to get healthy, eat the rainbow assortment of whole foods, not the rainbow assortment of Skittles.
Yes, true. Okay, so statins. Best way to not be on statins is to get healthy.
Yep.
Okay.
I'm off mine.
Yay.
I was on one since
Forever.
98 or 99.
Yeah.
Off.
Yay.
Done. Woohoo.
So the other group of medications that can affect the immune system is SSRIs, those medications that can be used
That sounds like
for
they're part of the CIA.
depression.
Oh.
Now, this is the deal. Do not, if you are on one,
do not stop it.
do not stop it. Okay? That is not what I'm saying, because I think of mental health.
It's a very different issue.
And
getting healthy does help. Exercise does help.
yes.
But don't just stop it.
Don't just stop them. But those,
Bad idea.
Those are a group of medications.
Especially when you're quarantined indoors.
Yeah. Don't stop it right now.
In fact, one of the rules I was taught that I think is actually a great rule when dealing with SSRIs, never stop them in the winter.
Oh, right. Correct. Because of seasonal affective disorder, SAD, right? Most people get more discouraged and more down. And now we're in this quarantine and it's bizarre and weird and our whole world has changed and what's going to happen, we don't know. So don't stop those right now.
And we keep looking outside and going, what's on the other side?
Well, and this is kind of the winter of our discontent, right?
Oh, yes, that was a good one.
Very nicely stated. Okay, so SSRIs. Okay, let's talk about over-the-counter medications that can affect the immune system. Doctor?
Why are they called over the counter?
Please do not go into lecture from your healthcare economics degree. about how.
As long as you don't go into your business degree lectures.
I won't.
Anyways,
So, what would you like to start with?
how about just Tylenol?
Okay, talk about it.
No, you can talk about it.
Tylenol, ibuprofen, specifically ibuprofen. They
The anti-inflammatories.
are anti-inflammatory, right? So inflammation is a function of our immune system.
I never made the connection.
Well, sometimes it's hard. So those medications purposefully
Decrease inflammation.
dampen the immune system. That is actually how they work. Now, does that mean don't take them?
No, that's
No.
not the point. But if you don't need them,
If you don't need them, don't take them. And
because a lot of people kind of, well, I might be uncomfortable, so I'll just keep taking it.
well, and one of the things that we found in our health journey is that we were taking 800 milligrams of ibuprofen like it was a full-time job. And
It was.
every day.
They were a lot of pills.
And we were taking high-dose Tylenol, extra-strength Tylenol every day. And
Just to move.
just to be able to not ache. Well,
Oh, I think our
hold on.
college-age kid just finished up a final.
Yes. Have you seen those videos of people working at home and kids running around? Yep. That's where we are.
I think he had pants on, though.
That's good. So Tylenol and ibuprofen, if you're taking them solely because you are aching,
Eat Whole
And-
Foods instead.
correct, and you are consuming a lot of processed foods, change your diet and you won't need it anymore.
Did I just hear a puppy come in here?
So, can you just focus for 1 hot second? ADD
Probably not.
much? ADD.
Ibuprofen, same thing. The way it works.
Yes, I do believe you do have a muffin in the room.
Oh, hello.
Okay.
You want to come up here? You want to come
No,
up?
it's okay.
See,
Hi, buddy.
we are. This is a live, not to, this isn't
So,
to tape. This
My
is all
little
live.
buddy just came in the room.
So,
Okay.
So,
right.
non-steroidals, ibuprofen. Ibuprofen affects the arachidonic acid system. It decreases cytokine responses. All the stuff I'd love to talk about.
It dampens your immune system on purpose.
And that affects, because it's affecting your immune system again, it's changing infection rates. Okay, come here.
So,
I'm just moving this for a second. Come here. Come here. You can't whine and then
just
then
pet
walk
him.
away.
Just pet him.
Okay, I'm going to lean over and
Okay, so
pet
the
my
other
dog.
group of over-the-counter medications that in more recent years has been shown to decrease the body's ability to fight infection is the group of medications
buddy.
related to reflux, heartburn, all that kind of stuff. So antacids like Tums, things like Pepcid that are called histamine 2 blockers, and then PPIs, proton pump inhibitors, over-the-counter medications like Prevacid, omeprazole, all of those types of medications. What we believe is that those medications are actually changing the gut bacteria.
Yep,
They're killing off
good bacteria.
good bacteria, like we've talked about 1,000 times, and therefore changing the body's ability to fight infection.
And one of the things that they really do is they increase the rate of fungal infections
Yes.
in the stomach, the throat, and the mouth,
Yes.
and the tongue.
Yes. So thrush, yeast infections in the mouth and in the esophagus that are very, very painful and irritating. It appears
Right.
that those groups of medications actually increase the body's or decrease the body's ability to fight infection.
Yeah,
So
absolutely. And like we were talking about before, yes, we actually talk about this stuff. We're kind of geeky. PPIs can do both rev up the system and suppress
yes,
it.
they alter the immune system's function either up or down, make it too hyperactive or not active enough.
Yep.
So those are some medications that can affect your body's ability to fight infection. So the message from all of this is, I'm just telling you, how do you get off these medications? Well, the first way to begin working on that is to eat whole foods. Whole foods are foods that have been very minimally, if not at all, processed. They don't have additives. They don't have junk dyes, high fructose corn syrup, all this kind of jazz added to it.
They don't need a label explaining the 75 ingredients that created the muffin.
They don't have the chemistry experiment on the side.
Absolutely.
So,
which I always think is a great way of looking at it. If you can't pronounce what's in it,
then it's probably processed. Probably. So, that's a scoop.
All right. So one of the questions we have over here is, what are those white balls on your dog's neck?
Okay. So the name, we have several, but we call it the pet crown. See this little guy? He's an adventuresome little guy, and he's kind of small. And actually, Becca's the one that mentioned it first.
Our daughter.
And then we patented this idea, which is
it's just tennis balls on a little collar.
And it keeps him from
and it keeps him from going through really tiny spaces, because he's very, very talented at finding little spaces and kind of squeezing his little body through and getting lost and getting really, really lost.
He got stuck under our deck before, and
on Thanksgiving Day,
we had to pry up deck boards to get him out.
So he considers it an honor
Yes.
to have his crown put on before he runs outside.
He always waits for his crown.
Yeah. So that is the question of the evening.
All right. So,
And if you want any.
what website can they go to where they can get to this?
Oh, yeah, forget it. Just go buy your own collar and
Hey, wait,
3 little
it's
wiffle balls.
patented. It is patented.
I know. Where are you going to sell it? Okay, go ahead.
All right. So let's just remind everyone that you can ask any question here, including about the dog's, crown, not balls. Yeah, now I'm all
He's not a
flustered. There we
Balchinian.
go. And then you can certainly, we encourage you to please share this right now. We have about 10, 15 more minutes that
You're
we'll
not
be
gonna sit
talking,
here the whole
answering any questions. We would love it. This is important information. And so we would love if you would be able to share it. I think Muffin's going to stop joining us now. And last, we're so glad you're here. Thank you so much for joining us. And thanks for being part of the MG Wellness community and sharing this. Dr. John, Dr. Kelly, what are some of the things that you can specifically do? Let's say you're not on many medications. Let's say you want to get off statins. What's the first thing you would do? And then as you take baby step after baby step just to start working to get off statins, what would be the thing you would do?
Well, the first thing that I would do is I would start with what I'm putting in my mouth, because
100%.
Exercise doesn't cover up or make up for putting garbage in your mouth.
And that's been shown by just years and years of quote unquote heart healthy diet and exercise. It doesn't do much to lower cholesterol. It really doesn't.
What doesn't?
Just
Exercise.
And what is technically called a heart healthy diet. You have to go to a whole foods.
Okay,
diet.
gotcha. Okay, so I would start by changing what's going in here. Now, every time we say that, I know that there may be some of you who go, oh, another diet. I'm not talking about a diet. Diets don't work.
Lifestyle change.
Don't even count a calorie. Get that app off your phone. Just eat whole foods, and you can fix them in ways where they are incredibly tasty and yummy, and you look forward to them. I never thought it was possible, but it is, and it is not an awful experience at all. In fact, it's freeing. It is freeing.
Because honestly, you can move so much easier when you get off of processed foods. And notice we didn't say you have to go vegetarian. That's not even the point. Because we know vegetarians that are incredibly unhealthy,
Right.
that are diabetic, obese, high cholesterol, all of it. It's all on what you eat And specifically, it needs to be whole foods. How do you know you're getting the right whole foods? Eat a rainbow of colors every day.
And that involves a lot of plant-based protein. I'm not saying that every bit of protein in your body has to come.
Not the Skittle cow.
Correct. Has to come from plants, but a good majority of your protein should come from those rainbows of colors that are in the produce section of your grocery store.
And
go ahead.
Oh, I'm sorry. You should focus on plant-based protein along with cold water fish.
Yes. So though that is the first place that I would start. Now, in a time where we have a lot of opportunity to sit on the couch, and in a time where there's a lot of discouragement and anxiety, I really would encourage everyone to walk, at the very least, walk
30 minutes.
30 minutes 5 times a week. I am just telling you, for everybody's mental health and physical health, just starting with that, just walking 30 minutes 5 times a week.
And you can wave to your neighbors from a nice
social distance.
Oh, good. Another
So,
dog just wandered in.
Anyway, that's where I would start. I think that's where we would both start.
Absolutely. I truly believe that is the main place to focus, not on losing my train of thought because a dog was
All right, another question. What are your thoughts on thyroid medication? Very low dose, 0.025 milligram levothyroxine. Whatever. You can pronounce that.
Levothyroxine?
That's why I'm a marketer and a producer, not a medical
Levothyroxine.
professional.
So
all right.
if you need it, you need it.
Yeah, it depends on the reason that you're on it.
But understand that thyroid disease is another disease that has occurred much more commonly over time because of processed foods and the destruction of the good bacterial microbiome in the gut.
So what can happen is that if the gut microbiome is maximized, perfected, you change your diet, all of that, there is a possibility, I'm not making a promise, but there is a possibility that you could go down on the medication. It's probably unlikely that you would go off it completely, but there is a possibility that you'd be able to go down on the dose of the medication.
Because one of the issues is if it's based on the development of anti-thyroid antibodies, your body's already developed it because of issues from before. And so it's going to be very hard to get all the way off.
Yeah, but you can modify the dose sometimes if you perfect that gut health.
All right. Donna asks, I read an article that certain antibiotics can affect collagen and may cause heart valve damage. Can you comment on that?
There are actually antibiotics that affect collagen enough. Not only do they affect heart valves, they can actually cause ruptured Achilles. I mean, yes.
True. True statement.
Antibiotics can affect other parts of the body. There's absolutely no question.
There's an antibiotic that's very, very common that was used massively about a decade ago. I mean, a lot. Ciprofloxacin. And it's a group of drugs other than Cipro. But Cipro, yes, Cipro is one of those medications that there was actually a warning a couple years ago about Achilles rupture, all of these very random side effects that can happen from this group of drugs.
One of its sister drugs, which was a wonder drug for about 18 months, got pulled off because of that heart issue.
Right.
Or similar heart issues. So you're absolutely right.
Yet another reason that we want to minimize the intake of antibiotics. Yes, antibiotics are an incredible invention that can save lives.
But only take them when necessary. And like we talked about, or actually Dr. Kelly talked about a few weeks back, once you take an antibiotic, it takes about 6 months for your gut microbiome to get back to where it was. And it may not even be at 6 months.
It might
back
be
to the
longer
same.
than that.
Because
Be sure that if you need antibiotics, like we've said before, take probiotics with good prebiotics to try to replenish whatever you can in your gut of the good bacteria.
and you should be on the probiotics and prebiotics anyway. But
make sure.
So one of the interesting things that goes along with that, because so many women get antibiotics during pregnancy or during labor for real reasons, babies end up with messed up guts. And what's been shown for colicky babies is actually using probiotics again.
Yep.
That is the best treatment for colic.
Yep.
So let's talk about the over-the-counter pain relievers like ibuprofen. Let's say you've had a significant injury. Obviously, we don't want to go into the Oxycontin and all those types of drugs, but you are taking an ibuprofen or Tylenol for pain management. What would be your recommendation there when you say, hey, I would really like to get off of that?
So, great question. And Nate always throws these out there without telling us about them ahead of time. One of the interesting things to bring up before we even get to the ibuprofen, Aleve, whichever, is that opioids have very significant suppression of the immune system. Very, very significant.
Yeah, we didn't talk about those, but that's
because we're trying to avoid opioids altogether. In fact, our team has been able to decrease the use of opioids in the post-surgical setting by 90 to 95% in our major surgeries that we do.
By doing other things other than focusing on
And we do
opioids.
use ibuprofen and Tylenol. But we even with that, and this is why I was getting to that, we tell people to take it for a week after they go home.
Ibuprofen and Tylenol.
Around the clock for a week to keep the pain under control. But after that, go to only when you need it.
Right. So back to Nate's question.
But
what else? Yes. So what else can we do? Well, I'm going to talk about something else that we do. Because of the effects of Tylenol and ibuprofen, and because Tylenol can affect the liver, and because ibuprofen can affect the kidneys, and because sometimes long-term ibuprofen can cause high blood pressure, are there other medications that can help control pain without being addictive, without being opioids? And we don't have any evidence, although you never know in medicine. We don't have any evidence that they affect the immune system. There's a group of drugs that affects certain hormones in brain and nerves, Neurontin or gabapentin or Lyrica. I am not saying that these medications are without side effects.
They have side effects, but we're talking about not immune system side effects at this point.
Correct. These are medications that can control pain from an injury and do not appear to have an effect on the immune system and don't give you all the side effects of opioids and get you off of Tylenol and ibuprofen.
And we use quite a bit of that when we're doing major surgeries.
Yes.
I shouldn't say we do. Our patients use quite a bit of that when we're doing major surgeries. On top of that, something else